Hi, hello again. Now we keep the interview with the speakers. Now for me it's a super pleasure because these two speakers are two very good friends. So not only they will transmit to us another knowledge about endo, it's a pleasure for me. The first speaker is Dr. Alejandro Perez Ron. He is from Venezuela. He lives in Portugal, and this morning he lives a super amazing lecture of a very hard topic that is microbiology in endodontics. And please, Alejandro, what you can add to the lecture? What do you think about the present? What do you think about the future in your topic?
Well, first, hello everyone, and thanks my friend Sebastian and Ronald for this opportunity to talk with you. About microbiology, I think that in the past, we studied a lot about the number of species inside the canal, type of species. So usually we will focus in who's there, who's this inside the canal. But from a clinical point of view, I think that is more important today probably change or different address in this field, moving to what are they doing there. Probably this is most important for to know the physiology of the species, the function of the species inside the canal, in order to develop different strategies for infection control. And probably we can do this with some methodologies. One of the methodology is metagenomics, that my friend Ronald Ordinola Zapata was the first in publish about that in endodontics. So for me, this is the future.
So that is perfect to me because I can introduce the second speaker. So another good friend, Dr. Ronald Ordinola. He's from Peru, but he's now, for a very short period of time, he's in the state, but he now is the director of the endodontic program in Minneapolis, in the University of Minnesota. So it's easy the question, and you speak about intracanal medication, but we can continue with some about microbiology and intracanal medication, the situation of the and metagenomic. Wow, that's great. It's Alejandro do not put you.
Information.
He do not put it very easy to you. Okay,
I
so you
know
had
it
to.
is too much. Yeah, what Alejandro mentioned, it is important from the microbiology perspective. It's not only what bacteria it is in the root canal, but also what is the function of these bacteria, proteolytic, do they have toxins, and how they can, affect the preapical tissues. And one advantage of it's called actually shotgun sequencing or metagenomics. Is that we are basically assessing all the genes that the bacteria can present, bacteria from the root canal space. And regarding your second question, Sebastian, the topic was intracanal medicaments. And nowadays, we can see that there is a significant amount of specialists that move towards the single visit protocol. And what we addressed in my presentation was basically the characteristics of calcium hydroxide that are beneficial for endodontic treatment or for the management of apical periodontitis. Mostly its antimicrobial activity, dissolution of organic tissue, and it's very useful also for the management of traumatic dental injuries. So that was mostly the first part. The second part, we had a more clinically oriented presentation with some cases and scenarios in which we need to use calcium hydroxide to make sure that we may have a favorable outcome for the patient. Mostly ill-defined radiolucencies like furcation involvement and cracked teeth, which we have a lot. And I think there's still a place for the intracanal medication, especially when we are treating teeth with rested tooth development. And other than that, well, thank you for having us in this quite informal interview here.
So thank you to both to be here. It's a real pleasure, and it's a real personal pleasure to me to can introduce you. And okay, we will continue with interviews in short period of time. Thank you very much.